The year was 1943, and America was deep in the Second World War. While most people back home were reading about battles in Europe and the Pacific, something was happening right here on American soil that would never make it into the history books. In a small town called Riverside, tucked away in the mountains of Colorado, people were going about their lives as normally as wartime would allow. The men who hadn't shipped overseas worked in the local mining operations. The women kept the households running, and everyone did their part for the war effort. It was the kind of place where everybody knew everybody, where doors stayed unlocked, and where the biggest excitement was usually the Saturday night dance at the community hall. But in the spring of that year, something changed. People started getting sick, and not just a few people. It started with the Henderson family, then spread to the Johnsons next door, then to half the folks on Maple Street. At first, the town doctor figured it was just a bad flu going around, nothing to worry about too much. But then the symptoms got worse. High fevers that wouldn't break, violent coughing fits, and a weakness that left grown men unable to get out of bed. Within 2 weeks, nearly a third of the town was bedridden, and the local hospital was overflowing. The doctor sent urgent telegrams to the state health department, begging for help, but with the war on, medical resources were stretched thin. Most doctors and nurses were overseas, treating wounded soldiers. Riverside was on its own, and people were starting to panic. That's when Private James Mitchell arrived in town. James Mitchell wasn't supposed to be in Riverside at all. He was a 26-year-old medic from Ohio who had been stationed at a military base about 60 miles away, training new recruits in field medicine before they shipped out. He was good at his job, really good, and his superiors had noticed. James had grown up poor, the son of a coal miner who died of black lung when James was just 15. His mother had cleaned houses to keep food on the table, and James had watched her work herself to exhaustion day after day. He'd promised himself he'd find a way to help people, to make sure others didn't have to suffer the way his family had. So he'd studied every medical book he could get his hands on, volunteered at the local clinic, and eventually caught the attention of an Army recruiter who saw potential in the determined young man. By 1943, James had seen more medical emergencies than most doctors twice his age. He'd dealt with training accidents, equipment malfunctions, and once even talked a fellow soldier out of taking his own life during a particularly dark moment. But what brought James to Riverside wasn't military orders. It was a letter from his cousin Sarah, who lived there with her husband and 2 young children. The letter was brief and terrifying. Sarah wrote that her husband was barely conscious. Her children were burning up with fever, and the town doctor had run out of medicine. She didn't know what to do, and she was scared her family was going to die. James didn't hesitate. He grabbed his medical kit, signed out for a weekend pass, and hitchhiked his way to Riverside. When he arrived on a cold Tuesday morning, what he saw shocked him to his core. The main street was nearly empty. Curtains were drawn in most houses, and an eerie silence hung over everything. The few people he saw looked exhausted and frightened, their faces pale and drawn. James made his way to Sarah's house and found her exactly as she described. Her husband Tom was unconscious, his breathing shallow and ragged. Her 2 kids, ages 5 and 7, were crying weakly in their beds, their small bodies shaking with fever. James immediately went to work, checking vital signs, trying to bring down the fevers, doing everything he could with the limited supplies he had. But as he worked, a terrible realization settled over him. This wasn't just a bad flu. The symptoms, the rapid spread, the severity of the illness, it all pointed to something much worse. Something that could wipe out the entire town if it wasn't stopped soon. James spent that first night moving from house to house, treating as many people as he could. The town doctor, an elderly man named Dr. Pearson who'd been practicing medicine since before James was born, was grateful for the help but also suspicious. When James shared his concerns that this might be something more serious than influenza, Dr. Pearson dismissed him. The old doctor was exhausted and overwhelmed, and he didn't want to hear theories from some young Army medic who'd only been in town for a day. But James couldn't let it go. He'd seen something during his training that matched these symptoms almost perfectly. There had been a classified briefing about potential biological threats, diseases that enemy forces might try to weaponize, and ways to identify them in the field. At the time, James had thought it was just paranoid military talk, the kind of worst-case scenario planning that probably would never matter in real life. But now, looking at the pattern of illness in Riverside, he wasn't so sure. The next morning, James did something that would change everything. He broke into the town hall's records office, searching through documents about the local mining operations. What he found made his blood run cold. 3 months earlier, a shipment of unusual materials had been delivered to one of the mining sites on the outskirts of town. The paperwork was vague, listing only generic descriptions and a series of reference numbers that meant nothing to most people. But James recognized one of those numbers from his military training. It was a code used by the government for experimental materials, things that were being tested for potential military applications. The mine where these materials had been delivered was upwind from Riverside, and it drew its water from the same underground aquifer that fed the town's wells. If something had leaked, if those experimental materials had contaminated the water supply, it would explain everything. The pattern of illness, the severity of symptoms, even which neighborhoods were affected first. It all lined up. James knew he had to report this immediately, but he also knew what would happen if he did. The military would descend on Riverside, quarantine the entire town, and probably classify everything as top secret. People would disappear into military hospitals, and the truth would be buried under layers of national security. His cousin Sarah and her family, all his new patients who'd started to trust him, they'd become numbers in some classified file. Unless he could fix this himself first. For the next 3 days, James worked around the clock. He convinced Dr. Pearson to let him try an experimental treatment protocol, though he didn't tell the old doctor where he'd learned it. Using his military connections, James managed to get his hands on specialized medications that weren't available to civilians, telling the supply sergeant back at his base that he needed them for a training exercise. He set up a makeshift clinic in the town hall, organized a few healthy volunteers into nursing teams, and started treating patients systematically, prioritizing the sickest first. The treatments began to work, slowly at first, but then more noticeably. People started to recover. Fevers broke, breathing improved, and the terrible coughing fits became less frequent. Sarah's husband Tom was one of the first to regain consciousness, and when her children finally smiled again, James felt a weight lift from his shoulders that he hadn't even realized he'd been carrying. But his relief was short-lived. On the 4th day, 2 men in dark suits showed up in Riverside. They didn't introduce themselves beyond showing government identification cards, and they didn't waste time with pleasantries. They went straight to the town hall and demanded to speak with whoever had been treating the sick. James knew immediately who they were and why they'd come. Someone at his base must have gotten suspicious about the medications he'd requisitioned and reported it up the chain of command. Now the government was here to clean up their mess, and that meant making sure nobody talked about what had really happened. The 2 agents questioned James for hours. They wanted to know how he'd figured out what was wrong, where he'd gotten his information, and most importantly, who else knew about the contamination. James played dumb at first, pretending he'd just gotten lucky with his treatments, that he'd simply tried different approaches until something worked. But the agents weren't buying it. They knew he'd accessed classified information somehow, and they were determined to find out how much he understood about the government's experimental program. Finally, James made a decision. He told them everything. About the mining shipment, the contaminated water supply, his suspicions about what had caused the outbreak. He laid out his evidence calmly and clearly, like he was giving a medical briefing to superior officers. The agents listened in stony silence, taking notes, their expressions revealing nothing. When James finished, the younger agent left the room to make a phone call. The older one stayed behind, studying James with cold, calculating eyes. Then he said something that James would never forget. The town was going to be fine, the agent said. The government would provide ongoing medical care to ensure everyone recovered fully. They'd fix the contamination issue at the mine, make sure it never happened again. But there was a price for this help. James had to disappear. The deal was simple and non-negotiable. James Mitchell would receive an honorable discharge from the Army, along with a new identity and enough money to start over somewhere far away. In exchange, he would never speak about what happened in Riverside to anyone, ever. He would cut all ties with his family, his friends, everyone he'd ever known. As far as the world was concerned, Private James Mitchell would simply cease to exist. The government would handle everything, they said. They'd tell his mother he'd died in a training accident overseas, send her a folded flag and a medal for his service. They'd tell Sarah and the other people of Riverside that he'd been called back to his base on urgent orders and wouldn't be returning. No one would ever know the truth about what he'd done or why he'd really disappeared. James asked for one night to think it over, but the agents made it clear that wasn't an option. If he refused their offer, he'd be arrested for unauthorized access to classified information, theft of military property, and a list of other charges that would put him in a military prison for decades. His mother would still think he was dead, but instead of dying a hero, he'd be remembered as a traitor. And Riverside? Without James to vouch for them, without his insider knowledge of what had really happened, the government might decide the whole town knew too much. Quarantine facilities could be arranged, permanent ones. The choice wasn't really a choice at all. That night, James packed a single bag with a few personal belongings. He wrote a letter to his mother that he knew she'd never receive, telling her he loved her and that he was sorry for all the ways he'd let her down. He wrote another letter to Sarah, thanking her for reaching out to him and saying goodbye, though he couldn't explain why he was leaving. Then he walked out of Riverside under cover of darkness, accompanied by the two agents who'd upended his entire life in the span of a single afternoon. They drove for hours, eventually arriving at a small apartment in a city James had never visited before. The agents gave him an envelope containing his new identification papers, a driver's license, a birth certificate, and a social security card, all with a different name. There was also $5,000 in cash, which seemed like a fortune in 1943, but felt like blood money to James. They told him he could go anywhere he wanted, do anything he wanted, as long as he never returned to Ohio or Colorado and never tried to contact anyone from his old life. Then they left him alone in that empty apartment, and James Mitchell officially ceased to exist. If you're finding this story as unbelievable as I did when I first uncovered it, do me a favor and hit that subscribe button. There are dozens of stories like this one, forgotten American heroes whose sacrifices were erased from history, and I'm committed to bringing every single one of them to light. Now, let's get back to what happened to James after he disappeared. The man who used to be James Mitchell spent the next 2 years drifting from city to city, taking odd jobs, and trying to figure out who he was supposed to be now. The government had given him a new name, Robert Hayes, but it felt like wearing someone else's clothes. He'd found a small apartment in Kansas City and gotten work as a janitor at a hospital, which was the closest he could get to medicine without raising suspicions. He'd watched the doctors and nurses going about their work, treating patients with the kind of authority and respect that he'd once hoped to earn himself someday. It was torture, knowing he could help but having to stay invisible, having to pretend he was just the guy who mopped the floors. At night, he'd lie awake thinking about Riverside. He wondered if Sarah's kids had grown up healthy, if Tom had fully recovered, if Dr. Pearson had ever figured out the truth about what had made everyone sick. He wondered if his mother had really been told he was dead, and if she'd believed it. Most of all, he wondered if saving those people had been worth losing everything else. The answer should have been simple. Of course it was worth it. He'd saved lives, maybe even saved an entire town from being wiped out. That should have been enough. But on the hard nights, when the loneliness felt like it might crush him, Robert Hayes wasn't always sure James Mitchell would agree. Then in 1945, the war ended. Robert was working a late shift at the hospital when the news came through, and he watched as doctors and nurses and patients all celebrated together, hugging and crying and rejoicing that the nightmare was finally over. American soldiers would be coming home, families would be reunited, and the country could start to heal from the trauma of war. But Robert Hayes had no one to celebrate with and no home to return to. His war had ended 2 years earlier in a small Colorado town, and there would never be a victory parade for what he'd done there. Still, something shifted in him that night. Maybe it was the joy he saw on other people's faces, or maybe it was just that he'd been running and hiding for so long that he didn't know how to do anything else anymore. Whatever the reason, Robert made a decision. If he couldn't be James Mitchell anymore, if he couldn't be the medic who saved Riverside, then he'd find another way to help people. He'd spent 2 years being invisible, and he was done with it. He started taking night classes to become a certified nursing assistant, using his new identity and carefully avoiding any mention of his Army medical training. It took longer than it should have because he had to pretend he was learning everything for the first time, but eventually he earned his certification. He got a job at a veterans hospital, working with soldiers who'd come back from the war carrying wounds both visible and invisible. Robert found that he was good at connecting with these men. He understood their trauma in ways that other medical staff didn't. because he carried his own invisible wounds from a different kind of battle. He knew what it was like to serve your country and then be abandoned by it. He knew what it was like to do the right thing and pay a terrible price for it. And slowly, patient by patient, Robert Hayes started to build a new life from the ashes of the one that had been taken from him. By 1950, Robert had become one of the most respected nursing assistants at the Veterans Hospital. He had a reputation for being able to reach even the most difficult patients, the ones who wouldn't talk to the psychiatrists or take their medications or engage with anyone at all. He'd sit with them for hours if that's what it took, never pushing, never judging, just being present until they were ready to open up. The hospital director once asked him how he did it, how he managed to connect with these broken men when trained therapists couldn't. Robert just smiled and said he'd learned a long time ago that sometimes people don't need someone with all the answers. They just need someone who understands what it's like to lose everything and keep going anyway. He never told anyone about Riverside or about being James Mitchell, but in quiet moments, he'd wonder if the government was still watching him. Were their agents keeping tabs on him, making sure he kept his silence? Or had they forgotten about him entirely, moved on to other secrets that needed burying? He never tried to find out. The fear of what might happen if he broke his silence was enough to keep him in line. But then something unexpected happened. A new patient arrived at the hospital in late 1950, a young veteran who'd served as a supply sergeant during the war. The man was suffering from severe anxiety and nightmares, though he hadn't seen combat. During one of their conversations, he mentioned that his nightmares all centered around a shipment he processed back in 1943. Experimental materials that were supposed to go to a testing facility but had been misrouted to a mining operation instead. He said he tried to report the error, but his commanding officer had told him to forget about it, that it had been handled. For weeks afterward, he'd waited for news of an accident or contamination, but nothing ever came. Eventually, he'd convinced himself that maybe the materials hadn't been dangerous after all, that his worries had been overblown. But the nightmares never stopped. Robert felt like the floor had disappeared beneath him. This man, this anxious young veteran, had been an unknowing part of the chain of events that led to the Riverside outbreak. And he'd been carrying the guilt and fear of it for 7 years, not even knowing if his mistake had hurt anyone. Robert wanted to tell him the truth so badly it physically hurt. He wanted to explain that yes, there had been an outbreak, but that people had been saved, that it hadn't been his fault, that he could let go of the guilt. But he couldn't. The deal he'd made with those government agents had been clear, and Robert had too much to lose by breaking it now. So instead, he did the only thing he could do. He worked with the young veteran, helped him process his trauma without ever confirming or denying what had really happened. He taught him coping mechanisms, got him to talk to the psychiatrists, and slowly helped him find a measure of peace. It wasn't enough. It would never be enough. But it was all Robert could offer. That experience changed something in him, though. For 7 years, he'd been content to live quietly as Robert Hayes, helping people one at a time and never making waves. But now he realized that staying silent wasn't just about protecting himself. There were other people out there carrying pieces of the Riverside story, suffering from guilt or fear or confusion about what had really happened. And by keeping quiet, Robert was letting them suffer needlessly. Robert started keeping a journal, writing down everything he remembered about Riverside in careful detail. The names of the people he'd treated, the symptoms they'd experienced, the timeline of events, everything. He wasn't sure what he was going to do with this information, but he felt compelled to preserve it somehow. If he couldn't tell the story now, maybe someday, someone else could. He also started paying more attention to the news, looking for any mention of similar incidents. Government experiments gone wrong, unexplained outbreaks in small towns, sudden disappearances of military personnel. He found more than he'd expected to. It seemed that Riverside wasn't an isolated incident at all. Throughout the 1940s and into the 1950s, the US government had been conducting all sorts of secret experiments, testing new weapons and technologies, often with little regard for civilian safety. Most of these incidents were quickly covered up, the evidence buried, the witnesses silenced. Robert realized that there were probably dozens, maybe even hundreds of people like him, ordinary Americans who'd stumbled onto government secrets and been erased as a result. The thought was both comforting and terrifying. Comforting because it meant he wasn't alone in his experience. Terrifying because it meant the government had turned this kind of cover-up into a routine procedure. In 1952, Robert did something risky. He started writing letters to newspapers under various pseudonyms, carefully worded messages that hinted at government wrongdoing without providing specific details or revealing his own identity. Most of the letters were ignored, but a few were published in small local papers. He wasn't trying to expose Riverside specifically, just trying to plant seeds of awareness, to let people know that not everything their government told them was true. It wasn't much, but it was something. It was a small way of pushing back against the silence that had been imposed on him. The letters eventually caught someone's attention, though not in the way Robert had hoped. One evening, he returned to his apartment to find a man waiting in his living room. Not the same agents from 1943, but clearly from the same organization. This one was younger, sharper, and he got straight to the point. The letters needed to stop. Robert's continued silence was the only thing keeping him safe, and if he couldn't maintain that silence on his own, arrangements could be made to ensure he kept quiet permanently. The threat was clear, and Robert understood that he'd pushed as far as he could. He stopped writing letters, destroyed his journal, and resigned himself to taking the full story of Riverside to his grave. But he also made a promise to himself. If he couldn't tell his own story, he'd make sure that the patients he worked with got to tell theirs. He became an advocate for veterans' rights, pushing for better mental health care, fighting to get benefits for men who'd been exposed to experimental programs during their service. He couldn't save himself, but maybe he could save others from the same fate. As the decades passed, Robert Hayes aged quietly within the veterans' hospital he'd devoted his life to. He never married, never built the life James Mitchell once hoped for, but he helped thousands of wounded men rebuild theirs. When the government's secret programs began surfacing in the 1970s, MKUltra, Tuskegee, and other hidden experiments, Robert watched with grim recognition. The world was finally seeing what he had known since 1943, though Riverside was never mentioned. By his 70s, Robert believed he'd made peace with his fate. Then, in 1989, a letter arrived from a woman named Jennifer, Sarah's daughter. She had spent years tracing rumors about a young Army medic who had saved Riverside and vanished. Through persistence and declassified scraps of military paperwork, she discovered that James Mitchell and Robert Hayes were the same man. Jennifer didn't ask for answers. She only wanted him to know Riverside remembered. She enclosed decades of family photos, Sarah's children growing up, grandchildren, anniversaries, an entire lineage that existed because of him. Robert cried as he read her words. He wrote back a short, careful note, never admitting anything, but letting her know her message mattered. For the first time since 1943, he felt truly seen. Robert Hayes died in 1995, quietly, without medals or military honors. His grave bears the name the government forced on him. Officially, James Mitchell still died in a training accident in 1943, but Jennifer kept digging. In 2003, after relentless FOIA requests, she obtained documents confirming everything: the experimental shipment, the contamination, the cover-up, and the disappearance of Private James Mitchell. She wrote a small, self-published book. It never became famous, but a handful of readers believed her. Some began asking questions about other buried sacrifices, other erased heroes. The book included a photo from Robert's memorial service, the first public glimpse of James Mitchell in over 50 years. He looked like any ordinary old man, unremarkable except for the truth his face carried. There is still no monument in Riverside, no acknowledgement from the U.S. government, no apology. But the story lives on in families, in whispers among veterans, in anyone who refuses to let forgotten heroes stay forgotten. James Mitchell saved a town and lost his entire identity for it. He spent the rest of his life healing others while no one knew who he really was. And yet his legacy endures, not in statues, but in memory, because as long as someone speaks his name, he was never truly erased.